reduce the eye pressure, or let's see. So we have different kind of eye problems, glaucoma, and a dry eye or macular degeneration. Glaucoma, we know there's a high pressure, normal pressure glaucoma, normal pressure. When the pressure is too high, then it damages the peripheral vision. And acupuncture can help optimize the pressure. Even your pressure is normal, then you still, if you have glaucoma, you still can damage your peripheral vision. So too low, too high is not good. So we have eye drop to drop the high pressure, but the eye drop can cause burning, dryness, and infection. So that's how we use acupuncture and acupressure reduce the side effect of eye drop, because when you use eye drop, it lowers the pressure, but when it's too low, you don't have sufficient blood circulation around eyes, then you get very dry, and then you tend to develop infection. So that is why acupuncture started become popular to treat this glaucoma. I have people have pressure like at 70 after a bunch of laser surgery, and then we were able to drop the eye pressure. Because when the eye pressure is too high, it's very dangerous. You can lose your vision quickly, the peripheral vision. So that is one eye problems. And then the dry eye is the one almost everybody have that. Like I would have that if I don't drink enough water, or my blood pressure is too low, or you simply working instead at a computer for too long, then your muscle get tight, and then the circulation is compromised, and that's how this dry eye kicks in. So if you ask people, a lot of people have dry, and we're going to talk about one acupressure point, which you see this eyebrow. There's a beautiful picture from eye doctor from New York. So if there's a 3 acupressure point, we're going to show you 1, 2, and 3. You see this last one on the outer point of this eyebrow. Just below is the tear gland. So this tear gland produced the tears, so to moisturize the eyeball. And then when you press this point, or when you needle this point, then you help bring the blood flow to this tear gland. Not only that, you also, by pressing those points, you can relax the muscle around your eyeball. So when the muscle relaxed, you have more circulation. So that will help the tear gland function better. The other thing is when you press those points, combining deep breathing, you actually kind of relax yourself. So the nervous system is not very hyperactive. That also helps the tear gland produce more fluids. So when you are nervous and then you feel dry mouth and your eye get dry because the gland function is reducing. So relaxation is very important. And macular degeneration in Florida is very common because the population age. So according to CDC, 9.1 million people were diagnosed as macular degeneration in 2010, and it's going to be increasing. So the symptoms would be blurry vision, and then when you see the straight line, it becomes curved, and also the central vision. Eventually it will be damaged. So that's the macular degeneration. There is a dry and a wet macular degeneration. The wet one basically is the leaking from the blood vessel. So when the blood vessel is leaking, then you have inflammation there, you damage the nerves in macular. That's that's the area responsible for the central vision. So if this continued inflammation continue to damage the macular, then you eventually lose the central vision. And that's for dry macular degeneration, it's more like the blood vessel and nerves are atrophied. So the dry macular degeneration, you don't have any treatment right now. You don't have eyeball injection. So the wet one, they inject the medication into the white part of the eyes, and that stops the leaking of the blood vessel. But the problem is with the eyeball injection, it just temporarily stopped the leaking, but it didn't improve the circulation or reduce the inflammation. So if you follow up those people who had like 5 years of injection, then I will ask them, I follow them for 6 years, 10 years, and I ask them, how's your vision? They said, oh, it's declining. So it's really not improving your vision. It just temporarily stopped the leaking. So that's why I like to introduce acupuncture, acupressure herbs to target the inflammation. Only if when you stop the inflammation, then the leaking will stop eventually. So not only you stop the leaking, but also you have to bring fresh blood flow to your retina, to your macula. That way the nerve can regenerate. Even you don't have anything going on, like with the aging, the nerves will degenerate. So there's always degeneration and regeneration, the two process. If you eat junk food and you eat too much spicy food, then the degeneration will speed up. That speeding up will compromise your function of the macula. So eventually we lose the central vision. So that's the two. The dry macular degeneration is even better with the treatment of acupressure and acupuncture, because acupuncture basically help to improve the circulation, relax the muscle, and also other points I'll show you will reduce the inflammation. So two things we need to be targeted. One is circulation, one is inflammation. And then for eyes, we need to balance the muscle around eyes. If it's too tight, it's compromised the circulation. So that is macular degeneration, dry eye, glaucoma. The earliest onset of glaucoma I heard is 8 years old. I think they stare at an iPad or something too much. And also, of course, there's a genetic factor. And the other genetic related eye problem is called retinitis pigmentosa. So that's also involved the inflammation, but it damages a different part of the retina. It's the rod and the cone cells. So they first noticed that the vision at night is compromised. But people come to me and they said, oh, I have this genetic factor, and I will tell them that the genetic factor only accounts for 15%. Before it says 30%. Now it's only 15%. It's not my comments. It's from the genetic specialists and biologists. So you can modify that 85% by diet, acupressure, acupuncture. So that is why we try to practice this acupressure. And then I'm going to introduce you different points, and my colleagues, Wendy, will be my model, so I'll show you different points. And then I want to introduce this. If you, like for instance, I talk about liver 3 or gallbladder 20, different points. If you couldn't remember from today's lecture, then go to YouTube, and then you're gonna type my name, Li Zheng. I don't know why this cannot. So let's see. Yeah. If you go to YouTube, you type Li Zheng, and you get this picture, and you click the picture, you get here, and then there's a group of acupressure point, like this acupressure point, there's a 23 videos there, and then you can follow that to do the acupressure. But today I'll show you the most common point around the eyes, around the hand, and then you can practice at home. But when you practice that, I encourage you to lie down instead of sitting up. Because when you're lying down, you automatically bring up your blood pressure. So when you sit there, your blood pressure dropping. So if you already have low blood pressure or you are taking a blood pressure medication, then you're sitting there, you're pressing the point, then your blood pressure can go down further more, then you reduce the blood flow to your eyes. And so that's not good because we want to improve the circulation. We don't want to reduce that circulation. So let me go here to show, Wendy, would you like to come here? Wendy is an acupuncturist and she's very good at showing us different points. Do you want to sit down? Of course, we don't want to lie down. Yeah, you can sit down now, and then I'll give you the microphone to you. Let's see, we have different points. You want to sit here so that you can, if you need to talk, you can grab this. Let's see, the most popular point I said is the triple warmer 23. So you want to hold this? You want me to needle?
See you better if you come around.
Yeah.
Where would you like me to sit?
On the stage, you can see it.
Yeah.
Oh.
You want that?
How's that?
Come on.
Come to the center. Can you come to the center?
Yeah, you're the.
Why don't you move me to get me situated?
I'm going to use this marker to put the point, and then if you need to talk, you can explain. So the triple warmer 23, I just showed just above the tear gland. If you do have dry eye,
It's on the outside, which is on the outside of the eyebrow, right at the tip. Sanjiao 23. It's also good for twitchy eyes.
do you mind if I put it there?
No.
Okay, so say the end of the eyebrow, and that's one. So when you press, you like to press little, put upward. That way you can help you.
Sanjiao 23.
Yeah, the drooping eyelid, because eventually our eyelid will droop. So if you push upward.
Just take your index finger, press down, and gently lift up. It actually feels nice.
Can I ask you a question?
Yes.
There's obviously a skeletal structure there. Is it on this bone or is it under the bone?
It's right at the tip of the eyebrow.
Yeah.
So
Right in the very end of the
Yeah.
eyebrow.
Yes.
Press and then lift.
Okay.
Okay. Now, the second point. So, if you press that, I prefer you to lie down. Okay. And then the other point is in the midline of the eyebrow. That's the midpoint here. The midpoint on the eyebrow. So that will.
Right in the middle of the eyebrow itself.
Yeah. On the eyebrow.
Right in the middle of the
midpoint.
eyebrow.
Yeah. If you press that, it's kind of sore. So the reason it's sore is because there's a lot of nerves there. So by stimulate those nerves, you kind of relax the
I
muscle.
see if Brady has it.
So let's do another one there. So right on the eyebrow. That's one. Oh, it does not stick. So, but we know it's here. And then the
Right in
bladder
the center.
2 is the other point. Is right at the medial end of.
That's one of my favorite points because it's a crossing block, many meridians. This point is a power point. Right over here. Bladder 2. Press and lift. My first time I ever had acupuncture was bladder 2. Changed my life.
Okay. The reason I want to put it here is because the bladder line go from the inner corner of the eye all the way to the back and ends up your foot here. So, and not only for the eyes, but also for your back pain. And when I was working in the hospital, I actually used that to treat very stubborn hiccup for cancer patient. So it's you kind of balance the nervous system. So when you have muscle spasm, you can relax them.
Well, the meridians for the bladder is all on the back. So it starts in the front. That's 1, 2, 3, 4, 5, and goes through the head all the way down the back. So the bladder meridian is 67 points.
Yep.
There's
That's
a
how
lot
many
of
points we
points.
have. Yeah. And so that's a very important point. So we have 1, bladder 2 in the midline of the eyebrow, and the third one would be at the end of the eyebrow, lateral side. And then the other important point is stomach 3, right?
Yes.
Stomach 3 is right below the pupil, and it's at the same level of the base of your nose and right below the pupil. So it's right here.
It's right on the cheekbone.
Yeah. Yes.
These points lift the face too.
Yes.
Natural.
That's stomach. Do you mind?
Please.
Okay. So that's stomach 3, and stomach 3
You all
is
have it.
yeah.
Yes, that's it. Yes, perfect. Just follow the nose and go right across.
Yeah, just below. Yeah, just right on below the pupil. Yeah, that's the 3, and the 2 is right on the orbit bone. Just stomach 3 and different level. It's right on the orbit bone, just below the pupil. But stomach 3, you have to be careful. Sometimes I press that, I can bruise myself because there are a lot of blood vessels here. So if do the stomach 2, you could bruise yourself. Don't worry. It's just the capillary.
So again, find the bone under the eye, and it's right there. I don't know about you, but I get puffy eyes in the morning. This is great to do in the morning when your eyes are puffy. I like to put ice in my eyes and all that. Just spend a moment and just press on them with an ice roller, or just press, and your puffiness will go away. Try it tomorrow and see what happens.
Yeah, and all of this point, you gotta lie down to do that.
Oh yeah.
Yeah, you don't want to sit there. I have a professional meditator, and she always argued with me. I started treating her when she was 80 something, and now I think she's 95. And she always said, I have to sit there to meditate. I said, no, you compromise your blood flow. And after 10 years, I treated her for other reason, neuropathy, and she said, oh, I have this macular degeneration. I said, you have to lie down when you meditate, but she couldn't do it. She said, this is the way she was trained. So I think this is the modern society, we don't lie down that much. How many hours you lie on the bed? So I think
So why don't we share what happens when we lie down? Our liver gets cleansed. We take a break when we just lay down. It cleanses our liver.
Yes, it's instantaneously improve your circulation to the coronary artery, to your eyes, and also balance your muscles.
It really gives your body a break just to take a 5-10 minute rest.
Yes. And interesting enough, when you sit there, your blood pressure actually is lowered, and I tested that with the patients. And when they're sitting there, I needle them, the blood pressure drop, they can think. So once you put them, let them lying down, the blood pressure come up, and they come back, the consciousness. So that's a 1, 2, 3, 4, 5 points. And the neck point, should we do the neck point or the hand? Maybe do hand, right?
Let's try hand.
Hand is easier, okay. We have the YouTube for the neck, gallbladder 20 and neck. You can go to YouTube. Okay, let's see. So first one, everybody knows this. This large intestine 4, right?
LI4. We've learned that one for headaches.
Headache, back pain, toothache. Yeah, but this one, it can drop your blood pressure easily. So you have to lie down.
Good to know when you feel tense.
Yes, that's one. And then I like to do the other one is it's called a triple warmer 4. So
It's right on the wrist bone.
it's on the wrist line. You see, if you go the hand like this, and then on the wrist line, on the outside of the wrist line, there is a ligament. If you do like this way, you see the
Well,
ligament.
let me show you. You can see the tendons. It's between the 4th and 5th metatarsal bone.
And then it's on the wrist line and outside the ligaments. So it's right here. But the other point I like to show you is is this one. You won't miss that. So you see here, it's between these two bones, metacarpal bones, number 5, number 4, and you go between that, and there's an indentation here. If you
It feels
press that,
great when you press it on. Give yourself
that's
a press.
the triple warmer 3. It's for the neck pain. For
The sinuses, it helps relax the body when it's tense.
Yeah. So that's the one. On the hand you have bunch. So you have 3 points. Yeah. Any questions?
Has everyone had a moment to find it?
What was the one between this one?
That's the triple warmer 3.
Yes, but what was it?
That's for, the triple warmer channel runs along this, on the side of the body, right?
It's got to do with the waterways in the upper portion of the body.
So, ear ringing,
Pardon me?
tinnitus, neck pain. Let's see.
Neck pain.
Neck pain,
Neck
ear
pain.
ringing,
Oh, ear ringing.
tinnitus, yes. And also the wrist, the hand pain, if you have hand pain. Yeah. By relaxing those neck muscle, you actually improve the circulation to your eyes. So that's another one. Yeah.
When you talked about the face, does any of that impact sinus?
Oh, yeah.
Yes, especially this one, stomach 3.
Right here?
Yeah,
About
right
it?
here, stomach 3. So you have actually 3 pairs of sinus, right? This one is 1 pair, and this one, it's the midline of the eyebrow, go 1 finger, 1 inch above, that's another pair of sinus. And then at the nose, let's see, you wanna hold this? So the nose, we have, if you go here, nasolabial groove, and in the middle of the groove, there's another one here. So it's like here. You see the groove in the midline of the groove. You press that, it's very sensitive there. Yeah, that's another pair. So 1 pair, and then 1 pair, 1 pair. 3 pairs of
This
same.
one feels just like bone, like skeleton.
Yes, it's bone, but there's nerves there.
Oh.
There's a nerve and there's a blood vessel.
So how do
Wherever you have nerve and a blood vessel, when you press that, you can trigger the reaction, send information to your brain.
Thank you.
Question in the back?
So can you do this on any side of your body, like, because I know you're doing it on your left side, so you can do it on your right, or like any side of your body?
Absolutely, either side works.
Okay.
Back to sinus, I feel the best sinus relief I ever got was bladder 2 right here. Clear fluid came flying out of my nose after 1 acupuncture needle. I've been sold on since. And I haven't had sinus trouble either.
So I usually put 1 needle here. This point is very interesting. When I put needles here, I won't fall asleep. So if you don't want to fall asleep when you're doing the meditation, you're lying down, right? You do the acupressure. I never fall asleep when I do the acupressure. Very interesting, I tried. So
What's the primary point for glaucoma?
I mean, all of this is good. Like especially there's three, right? On the eyebrow, there's three, medial, midline, and outside. And this stomach 3, stomach 2. Yeah, this is all good. But then go to YouTube, find the neck points also. Because when the neck muscle is tight, it also influences your eye pressure. Even the ophthalmologist does not agree, but Dr. Rosenfarb in New Jersey, and he worked with an ophthalmologist, and they actually do acupuncture 3 times a day. And then people from all over the world to go there because they don't want to get blind, right? So they spend $1,000 there and get treated intensely for 2 weeks. And then they do 15 minutes, 3 sessions each day for 2 weeks. And then they monitor with the machine. They see the blood flow, they monitor eye pressure, instantaneously get improved. But the problem is when you have this temporary relief, it does not mean your nerves regenerate, right? Your nerve need a continuously fresh blood flow and reduce the inflammation. You intensely treat only for 2 weeks. After 2 weeks, you don't get treated, the nerve is not going to regenerate within 2 weeks. Yeah, that's so patients come from them because you have to fly there, you spend $1,000 there for 2 weeks. I said, yes, you can test it, the blood flow improved, your eye pressure optimized the right way, but they have to come back for the long-term treatment. The nerve needs a long-term. You didn't damage your nerve within a few weeks, right? You damage that within a few years. You take longer time. So you need to find a local acupuncturist. You do initially twice a week, combining the herbs, and then and eventually do like once a week or every other week. And that's more practical and more effective from the long run. I can guarantee that you get a machine. I have a patient, he's a writer. He bought a $7,000 machine to monitor his eye pressure. And I said, after acupuncture, you measure your eye pressure. He said, of course, it's lowered, but it won't last forever. You have to do your own work, and that's the work.
When you say this glaucoma pressure and blood flow, are you talking about the inside of the eyeball itself, which is that like a vitreous gel substance or something?
No, it's the fluid circulating around the eyes.
Around the eyeball.
Yeah.
Okay.
So, around the eyeball, especially inside here, that's bring another point because your fluids will drain here. Mm-hmm. If you block that drainage, then the pressure will go up. So that's why there is acupuncturist in. Let me show you this point, which is very important because. Wendy, the bladder 1, so we're gonna show that bladder 1. You wanna point that bladder 1? So, yeah, it's right the corner, in the corner of the eye. So, right here. You see? So if you use the middle or index finger, you press upward, inward, so you don't press your eyeball, press on the bone, and you feel the pressure, right? Yeah, there's an acupuncturist in New York, and he has so many patients, he used thick, long needles to treat that, and I wouldn't do that here because people get scared when there's bruise, and so easy to bruise here. Yes, a lot of blood vessel, that's why
I also want to mention just doing simple eye exercises is very profound. You wake up in the morning, you look to the left, you look to the right, you look up, you look down, and you're actually exercising the muscles of the eyes. Don't take that for granted. That's very beneficial when done consistently. So yeah, exactly. I like everybody who's doing it. You look to the left, look to the right, look up, look down. Especially when you wake up in the morning, you've got to get the muscles moving. That's the eye muscles.
Yeah, the other thing is when you look left and then you look in the middle and look right, it's actually triggers nerve responses, and that's the treatment for anxiety. The psychologist has this eye movement treatment. There's a name there. I forgot what's the name, but you look left and you come back, look right, and that's changed the tone of the nervous system. So that's
Our eyes are always looking down or straight ahead. They're never looking up or to the left or to the right. You've got to exercise the eye muscles.
all right. So any more question? I don't know what time is it. Is it? Okay. You need any? You want to ask any questions, or we can?
How many times do we do that left in the morning?
In the morning, in the eye movement.
10?
10.
10 times. Thank you.
First thing in the morning.
All right. Then we showed all the eye point, the hand point. There's another point I want to show you. It's very easy to locate. There are 2 points. One is triple warmer 5 with. I'm gonna. When do you want to show them? Yeah, let me. You talk and I put the.
Okay, it's between the ulnar and the radius, which are the 2 bones on your forearms. And it's about 2 fingers breadth approximate to the wrist.
So, it's 2 inches, 3 fingers.
3.
So this is the wrist line. You see the wrist line, right?
Red
And then
stars.
you have 3 fingers. Line up the index finger with the wrist line, and you got between the 2 bones, and that is the triple warmer 5.
This place is very good for any kind of ear trouble.
Yeah. So
Hearing, tinnitus,
yeah, because
itchy ear, anything that's going on with your ear. It's really, and it feels good when you press on it.
yeah, and actually on the corresponding side, like you locate it here, right? And on the other side, just corresponding side, that's the point that for heart problem, anxiety, just calm down the nerves. When you have like fast heartbeat, for instance, you have AFib, right? AFib is very common here. And actually there's a research showing that when you're combining deep breathing and pressing this point between the tendons and line up 3 fingers around the wrist line, and this point actually slows down your heartbeat. And my another colleague, acupuncturist, her husband had a heart attack. They didn't know because he never had a cholesterol issue, but he eats a lot of spicy food. So he has inflammation in the blood vessel, and he suddenly had a chest pain. So the acupuncture, my colleagues needled at this point, and the chest pain went away because it opens up the coronary artery. And then the husband refused to go to hospital, but the wife said, you have to go. They went there, they find over 85% blockage of the coronary artery.
Wow.
So he got a quadruple bypass. So this point is very good when you meditate. You can do both sides.
It's really a PowerPoint.
Yeah.
When you hold these pressure points, how long do you hold them?
30 seconds, 1 minute?
I do a minute.
A minute. Yeah.
So you're
Yeah.
pulsating, getting blood flow is what you're doing.
And just steady pressure
Steady.
Yeah.
on the point.
You can alternate both sides because if you only do one side, then your hand hurts. So
Can you just do both at the same
you
time?
can, but it's very hard because I like to combining deep breathing so that you not only get blood flow, you also increase the oxygen level. If you do both sides, it's kind of hard. You're not relaxing. If you can
You're
try
working
that.
so hard.
Yeah. So that's the thing.
Is there another point for thyroid dysfunction?
Thyroid.
Yeah.
Yeah, the thyroid, the stomach 9, we showed one time, right? So
We'll show you stomach 9.
yeah, the stomach 9.
There's a lot of dietary changes you can make for
Yeah,
thyroid.
the thyroid.
Talk to me about thyroid later. I'll have some answers for you on that one.
Yeah. So this is the Adam's apple, right? And then so you draw a line parallel to the ground, and then it's right here.
Stomach 9.
So you have this muscle called sternocleidomastoid muscle. She's the perfect model because you see her muscle here. And then in front of this muscle, and at same level of Adam's apple, you can press here. And you want to turn a little bit. And then between this two head of the sternocleidomastoid muscle, and there's another spot.
It actually feels really good putting
Yeah.
pressure on it too.
But be careful, this drop your blood pressure. Yeah, it can easily drop your blood pressure. So when you press that, you definitely want to lie down. So this is the one.
It's basically in the center of the neck.
Yes. So there's two. If you press that, you can feel
Yeah,
the soreness.
right in the center.
Yeah. So, but answer your question about thyroid problems. Thyroid problem has like hypothyroid or autoimmune Hashimoto's. So Hashimoto is autoimmune, and autoimmune means your immune system hyperactive, attacking your thyroid gland. And the reason is because either you are under stress, your nervous system out of balance, so that your immune system out of balance, or you could eat too much spicy food, nuts and seeds to stimulate your nerves.
Allergies.
Yes. So it tip over the balance of your immune system, and it produce antibody attacking your gland. And when the gland damage, it release a lot of thyroid hormones. So you first have hyperthyroid condition with Hashimoto. And that's very dangerous because your heart rate goes up, your blood
Quick
pressure.
metabolism.
Yes, and you lose weight. So hyper is very dangerous because, and then they have to destroy your gland or partly move the gland because they don't want you to have heart problems.
You're
Or,
burning out your system now. It's going
Yes.
too fast.
so hypo is not dangerous. You just don't feel well. You gain weight, you have water retention, your circulation is not good. So there's two kind of condition. You know, you can use herbs and a diet change to balance, to helping improve the thyroid gland function or balance the function. All right. Any more questions? Okay. Thank you. You want to take a picture? And then I take it off?
Help you remember. It'll help you remember the points. This is like face lifting too. Like I said earlier, these points lift the face naturally.
You said this one was for ear and then outside.
Correct. It's
ear.
Sanjiao 4. Yes.
Yeah, the one closest to the edge.
Yes, it's between the second and third metatarsal bone.
Oh, second and third.
No, it's fourth and
Fourth and fifth, excuse me.
Yeah, so you can come closer to see the points, and I can even needle those points. If somebody is brave enough, I can put the needles there. Who is brave enough to?
Come on down.
Yeah, Lisa is very brave. You want to sit here?
She dropped her glasses.
Oops. Thank you.
If you want to, you can take off those things. So this is the official point. Okay, you take this. And this one you won't think. The bladder 2, I'm gonna lift your eyebrow. And this is for the sinus. And what else you wanna address?
Spots on my hands.
That will take a long time. That's not the instantaneous. Yes. So that is the facial needles we did. So let's see. I want to point up. Okay, you're gonna take a deep breath in. You're a little sore there. That's one needle. That's bladder 2. Those points, usually you're not gonna faint, but the neck point and hand point, I wouldn't do that because, you know, I don't know how she's gonna respond. This one, triple warmer 23. That one for a dry eye, glaucoma. So we're gonna make her look even more beautiful.
And the needle, is it puncturing? Was it puncturing? It's puncturing the skin and what?
Penetrate the skin, going to the muscle, going to the
There's a
dermis.
muscle there. that
Yeah,
you're
going to the
injecting.
muscle.
It's
Yeah.
subcutaneous, so it means it's just above the surface.
So
The
just both
muscles?
sides.
It's subcutaneous.
Subcutaneous.
Yeah.
It doesn't go all the way in, it's just right on
Okay.
the surface of the skin.
Deep breathing.
So surface subcutaneous into the muscle or around
So,
it?
Around.
I can feel that one too.
yeah,
How do you
it's
know
a
that?
very
How do you
sensitive
not
spot.
puncture it?
Yeah.
It's just,
You
Let's
tap.
try another spot.
You feel it
It's
quite gentle.
the
She's really
midline
quite
of the
gentle.
eyebrow. You wanna lean over so that just in case you don't feel well. Yeah, just
Lean
lean
back?
over. Yeah, lean back. Yeah. All right. Take a deep breath in. Okay, now we're not gonna do this. Not only kind of helping the eyebrow, I point up so that you know it can lift the eyebrow, so it won't
A facelift?
facelift. Yes.
Doc, do you know what another great point is?
Great.
Do 20.
Do 20.
Do 20. It's like a whole body facelift.
Yeah. The do 20 is the point that I really like to. You mean the 百会, right? So this one is you put your middle finger, that middle finger at the apex at the top of your ear, and then your both thumb meet. Yeah. Yeah, this way is better. Yeah, this way. The top of your ear and your middle finger meet on the top of the head. You press that point.
It's right on the center of the head.
Yeah. So
And what does that do?
that's a relaxation point. And what else?
Lifts the whole body. It's like
Yes.
a body facelift.
Like
Like
prolapse.
if you have bladder problems, you need to lift a little bit. This is what it's going to lift you.
Yep. So I usually put this when I get agitated by my kids. So
You do this one?
I put the needles there.
You put the needle there?
Yes. And sometimes I forgot. So I
It's
just
just
leave
walking
it
around
there.
with
That's
the
how
needle.
relaxed I am.
I'm always caught
So-
walking around with the needle.
Yeah. So this top of the
Oh, she
head.
must be in her office.
All right. She's a needle. Yeah, so this one is very good for relaxation. And usually people don't get fainted, right?
No.
I don't have problem with this. So, and then between the eyebrow, the midline,
Okay.
that's the one you can open up the
Pineal
the
gland.
third eye.
The what?
The third eye.
The
If
pineal
you
gland.
practice.
What's the third eye?
You
Center of knowing.
Chakra.
It's a
Your center
main
of
chakra
knowing.
or something?
Yes. Pineal gland. Pineal.
Get here.
It's your awareness of life. It's directional. It gives you direction in life. Yin Tang.
Cool.
Yeah. So the other benefits by pressing here or put the needles here is it relaxes the muscle here, so you can reduce the Botox number. You know, people here, they get Botox every 6 months to paralyze the nerve here, and so the muscle can relax, so you don't have the wrinkles there. I never had one, but I have patients who had that for many, many years. And when she approached menopause age, because the nerve function is compromised, so she got one, she couldn't swallow. And so that's the end of a Botox for her. So there's a Florida couple actually, they got a Botox and then I think they bought it from a chiropractor who didn't dilute the Botox to a certain level. So both going to the coma.
Oh my goodness.
Yeah, because the mechanism is paralyze the nerve. And if you're paralyzed to a certain point, you lose your nerve function. Your nerve have hard time to come back. So that's another thing.
I also like to share, we're lifting the muscle. Isn't that what we're trying to do?
Yeah,
is
I
lift
think
the
you're
muscle?
too light. Yeah.
With needles in the face, we're actually lifting the face. Isn't that what we're trying to do? We don't want to paralyze anything. We want to lift. Lift Zheng 23. Lift here. This is going to give us great results.
All right. Any more questions?
Questions,
All right.
anyone?
Thank
So
you
what do
very
your
much.
needles feel like? You don't feel,
I like them.
you like them?
I just understand how it works, so I think it makes a lot of sense.
Yeah, she has had acupuncture for many years.
Yeah.
Yeah, she had a different kind of acupuncturist. Yeah, I'm your last one, right?
Yes.
Yes.
My current one.
I've heard there's Japanese acupuncture, Chinese acupuncture. I don't know what that means. Is
Yeah,
there?
the
are you familiar?
Japanese, Japanese are very tight, right? And they always work hard and they work until they die. So they cannot tolerate the deep needles. So this is Japanese needles. It's very, very skinny. I only use that on the face. And so they do a very, very superficial insertion. But Chinese needle is thicker and we do different levels. Like on the belly, I can do 1 inch, 1.5 inch, like this long. And on the butt, I can go 3 inches.
Wow.
That's reach the peripheral muscle. Because if you look at the structure of your SI joint, the peripheral muscle is very, very deep. That's why when you have sciatica, if you go to massage, you feel good, but the pain didn't go away. But if you use needles, it go deeper level. And when we turn the needles, it stretch the muscle fiber. And then they send the information to your brain to readjust the muscle, to rebalance the muscle.
I have one question. For hearing loss, do you have any point?
Hearing loss, yes, I think hearing loss is kind of a structure changes. If you want to be treated, that's a long-term treatment. Ear ringing, it might work. So it's a damage the nerves. Yeah.
Less, she cannot hear. Hearing, I can't hear too good.
Yeah, that's probably take a long time to help the nerve to regenerate. But if you reduce the inflammation of the nerves, then your nerves are not so sensitive. So when you wear a hearing aid, it's not so irritable. So that's the thing you can improve.
With diet or with what?
Diet, definitely. If you talk to people who eat a lot of spicy food or eat a lot of nuts and seeds, they always has phlegm here, and they usually have hearing problems. And people who eat a lot of sugar, like me, when I was little, I eat so much candies each year, and then I get this laryngitis. And you have a eustachian tube to connect here to your ear, right? When you have inflammation here, it influences your ear. So my hearing is not perfect because if I go to bar, I couldn't hear people, the noisy environment. And so I never use the ear plug. I don't go to a loud noise area. I was thinking why I have this hearing issues when I go to the bar. I don't usually go to bar, I hate it. And then I think about my laryngitis because I had it twice a year for so many years when I was little, and the inflammation influenced this middle ear.
You think it came from here to here or the reverse?
Either way,
Either way.
yeah. If you have inflammation here, then it influence here. but most likely it's the throat because people eat a lot of sugar, salt, and the nuts and seeds. People argue with me, especially in almond milk, because there's this guy. I observe people to take so much nuts, the vegans, and then they were like, "What?" You talk to them, they couldn't hear you, and then I try to look at the medical history, and then I find a bunch of people who suddenly lost the hearing. Like they would have an allergy for years and years, they have ear ringing, right? One day they grab a bag of almonds and they eat it, and after a few days they couldn't hear it. Because the histamine, the nuts stimulate, suddenly make this nerve inflammation become worse and worse. So they suddenly have hearing loss. I see a few cases of this. So if you eat a handful of nuts and you feel you have phlegm here, stop eating. And never eat handful, eat 3 to 5.
And you say that's histamine, so what else is histamine?
The almond,
Besides the nuts, what other foods?
any spicy food, sugar, alcohol, what else?
Peanut butter is number 1.
Yeah, peanut butter is the worst. Peanut butter is the worst. There's a neurologist and he is early 30s. He eat healthy, he cook his own food, and now he developed ALS, you know, the inflammation it's autoimmune. And I asked the mother, I said, did he eat junk food? She said, no, he cooked his own food as a neurologist. But I said, does he eat nuts and seeds? Oh, she said, he lives on the peanut butter. That's the worst. Yeah, so.
Is there a connection, do you think, nasal lavage?
Yeah, the sinus,
Okay,
yeah.
So,
The sinus, it's all histamine because when you have high level of histamine causing by special food, sugar, high salt, nuts and seeds, almond milk, then your blood vessel is leaking. So when it's leaking, macular degeneration in eyes, and then vertigo or hearing problems in the ear. Here is the laryngitis. So it's different area, depends on the genes, which area is more vulnerable.
is there any connection between the nasal sinus lavage, or when you're doing lavage, that would go into, feel like it's going into your ear?
Yes, you can.
There
Yes,
is.
there is a connection, a nose and so that's why the ENT, an all group of one department. Yeah, so that's so just watch the nuts and seeds, and people always argue with me. I saw so many vegans and 50, 40 years old, they couldn't hear me. What? That's the hearing problems. So
Too much alcohol.
they don't drink alcohol. They eat very healthy. They don't eat sugar. They think, the almonds are good. They have handful of almond, handful pecan. I actually have a few cases. People eat so much nuts and they develop Parkinson's. Yeah, so moderation. You're okay?
Yes.
You're not fainting? No. Okay. Thank you very much. Can we get a picture here? And Wendy, we're here. Yes, with our
With the needles?
yes, with our models.
Thank you.
Thank you very much. Thank you for
That's good, right?
spending time.
Do you think
Thank you.
caffeine has any effect on any of the things you've been talking about?
What's that?
Levels of caffeine?
Of course, I mean, coffee stimulates the norepinephrine, the stress hormone release, but stress hormone also make you more motivated. So that's why it's antidepressant. It's so hard to get rid of that. Like this gentleman, he's very healthy, but he loves his coffee. He has this big mug of coffee every day, and he complaining he couldn't sleep. And then he complaining is because the World War II, American bomb Italy. So, but it's different. It's different because when you're 20 years old, you can tolerate 1 cup of coffee, and I'm 60 years old. I can only tolerate even 1/4 coffee. I drink that, I'll wake up at 2 and there's no way I can go back to sleep.
But it doesn't have any effect on dehydration or anything?
Yes,
or
definitely it's dehydrated, even tea.
Even the phlegm?
Yes, if you dehydrate, you got phlegm. Yeah.
Coffee is very hard on your adrenals.
Pardon me?
Coffee is very hard on
Adrenals,
your
oh,
adrenals.
yeah.
They say it's good for the brain, but it compromises your adrenals. So
What's more important, your brain or your adrenals?
Trade-offs.
And it's a diuretic.
And it's a diuretic, yeah.
So if you're gonna drink coffee, you better drink some fluid, back it up.
Yeah, the water is more important.
Questions?
Yes.
Go ahead.
What about someone that was born with a smelling dysfunction? Like they
Well,
cannot smell anything.
Oral factor. You have oral factor. You can't smell.
They cannot smell at all, or they just at all?
They don't smell anything.
Oh,
That's
okay. It's not
different.
after virus infection. Okay. Then probably,
It just, like he has to be real strong for them to smell it.
but if there is a very, very strong smell, do you think they can smell that, or they just cannot smell at all? It's, you know,
Like, I feel like if it's a strong smell, like, but it's little. It's little, like,
I've heard this happening after COVID. Was this prior to COVID?
Yeah, it's none of that. It was way before that.
Before COVID.
Like, sometime, there was a time, like, the house, like, somebody can feel something burning. And his daddy's yelling at him. He said, you are here. It's like he didn't smell anything, but clearly he said, I didn't smell anything. But everybody else smelled it, even his mom all the way up there. So it's like, it's some problem.
that's probably going to be hard to correct that.
Yeah, that's a difficult one.
Yeah.
I've heard you can retrain your, I don't know what you call it, your smell organ, whatever that is, in the brain.
It's called the oral factor.
Is that a point in the brain? They say by training, by training, actually sitting down with various smells, maybe 3 or 4, something that are fairly
You can
strong.
train yourself?
That's what I just read recently, where you can train your brain to bring that back if you're,
To remember what you already know.
yeah, like oranges or lavender or vinegar.
Oranges are great to smell in the morning. If you don't even eat them, smell them. They're very invigorating.
Right, so. But there isn't an acupuncture place for this,
For smell,
for the
no.
olfactory.
I mean, the nose, it depends on if it's the central or peripheral, right? Yeah, so those sinus point, it would help if, because of the allergies or because the inflammation. But if it's genetic, olfactory, if the cerebral cortex or is the sensor of the olfactory.
Have you heard of the neti pots?
Yes.
They're very effective
Uh-huh.
when used regularly in the shower. Just salt water and warm water and just right down
More
the
so
nose.
than the nasal lavage, the Medi. whatever.
I'm familiar with the other one, so
Okay.
yeah. I leave it in the shower. It's warm water and salt, and you just pour it down your nose, and it keeps bacteria and keeps the nose flowing clean.
Mm-hmm.
Because that's what happens. It gets bacteria gets caught.
It is bacteria.
Yes. So, but try the neti pot. Very convenient in the shower.
What would you recommend for, I've been reading a lot about inflammation
Mm-hmm.
and the connection between, you've got a lot of bacteria in your mouth. Goes down your
So
stomach.
there's so many things
Goes
on
into
it.
your
One of my
blood, goes to
favorite
your
things to
brain.
do, I'm sure you've heard of it, is coconut. Wish your mouth out with coconut.
Coconut oil, coconut milk, coconut what?
Coconut, the grease.
Raw.
The,
Coconut
the grease
shredded?
itself. No, the
grease.
coconut grease.
Grease.
It's the actual grease itself. So you take a scoop of it, you swish it in your mouth, and it cleans the mouth, it cleans the tongue, does magic for the gums if you have any gum trouble.
What's it taste like?
Coconut.
Coconut,
But
greasy
you don't,
coconut?
it's not a pleasant thing, I have to tell you. It's not something I like. And then you discard it. You don't keep it. You swish it in your mouth. Shh, shh, shh.
It's supposed to be good for your gums and your teeth.
Well, it cleans the tongue, it cleans the mouth. Because bacteria lives in the mouth at night, right?
Yeah, right.
Then you shouldn't do it more than 7 days. You should take a break. But you just go to your local Publix and pick up some coconut grease. Instead of cooking with it, you're swishing it with like a mouthwash.
Where do you find that? You ask.
Baking section probably. Except you're not going to be
Next to the
baking.
crystal?
But it does do amazing things for the tongue. Try it. It's lovely.
For cooking, I never thought about eating it.
Questions? Any other weird things? Oh, did you want to talk about the thyroid? Thyroid, you take additional selenium in your diet and iodine. If you're hypo, those two supplements are very helpful. Have you heard of that? 400 milligrams of selenium and iodine. Iodine is very important. You probably don't like to eat seaweed salads, but that's very good for the thyroid, low thyroid.
What kind of salad?
Seaweed salad?
Seaweed.
Good for low thyroid. Again, it's a mineral deficiency when you're hypothyroid. I know I was. And then, of course, there's a lot of supplementation. You can take glandular supplements from cows or pigs. I prefer them over the synthetic ones. But that's a matter of choice. Any other questions on thyroid?
No, about shrimp allergy. Shrimp.
Excellent. Absolutely. Excellent for thyroid. You're low on minerals. A lot of our diets are deficient in what we need. Shrimp would be perfect. Stay clear of tuna though, that's for mercury. Tuna fish. I'm a little opposed to that with all the mercury we find in our water.
No, she was talking about seafood allergies. Shrimp.
Shrimp allergies.
Oh, if you're allergic to it, just stay away from it.
It's sudden. It wasn't something current. I mean, it's something current. It's not like she added and it became current where her,
Thyroid gland would swell.
yes.
Well, it's probably because it's providing too much of the mineral that she already has enough of. That's the reaction of the swelling. The body will talk to you and listen. Look how happy she looks in the front row. She's glowing. She's glowing. Everybody look at her. Look at her. She's just rosy cheeks and I just got acupuncture. I'm happy. I'm happy.
Happy face.
So if
Thank
you, I have this this book about allergies and thyroid issue. So if you can, if you want to read that and write me an email and give me some comments about the book, then you can have the book. And
What is the title of it?
it's called The Chinese Acupuncture and Herbal Medicine for Common Disease. And then there's also this iBook, which shows you all the acupressure book, the points. And then if you go to YouTube, you just type the name, and then you follow that to practice.
That's great.
Yeah. Okay, thank you very much.
Thank you so much for coming. Bye now.